Back on Morning Line, thanks for joining us. Our guest this morning is Clint Kelly, malpractice attorney here in town. Taking your phone call, 615-737-7587. Question about whether or not maybe you have a case. Remember, just a bad result when you go to the hospital is not enough. Clint in the last segment kind of laid out the fact that you have to have 2 or 3, key provisions to have a decent case. But doctors aren't always miracle workers. Sometimes you go in, they do everything you can, and you still have a bad result. That's not a lawsuit.
That's correct.
Okay, just keep that in mind. A lot of people think, well, I went in and I died, or my loved one died, and they must have messed up on me.
An injury or a bad result is not a presumption of negligence.
Gotcha. Let's go to Greg. Greg, good morning.
Hey, good morning, guys.
Hey, Greg, how can we help you?
Yeah, I got just a few things to say. People kind of focus on the wrong thing. I mean, the reason why we should be doing, malpractice lawsuits is because I don't want whatever would happen to me to happen to someone else.
Sure.
It shouldn't be the focus on money. It should be the focus on making our medical profession better and accountable for what they do, so that it doesn't happen to your neighbor or your friends or anyone else.
But you would agree, too, you might want to also sue for money if you've been permanently damaged to be compensated for that, right? If you couldn't work anymore because of something that happened?
Right, of course. I mean, the money part of it is always necessary because of those reasons. Yeah. But I think that the primary focus of the lawsuits, should be for, looking out for the other person to make sure that whoever the doctor is doesn't have the same situation happen to someone else.
Sure.
And also you also should be compensated monetarily. But what gets me about the whole medical profession and all these things is that we have the FDA that is supposed to check vaccines and drugs and all these drugs that go out there in the market, and they just let these drugs just fly out there to where people start taking them and doctors start prescribing them, and then you've got all these people that have all these bad side effects a year later. Why isn't the FDA, why isn't there a major lawsuit against the FDA for approving these drugs? Because it really gets me that all of a sudden we see on the news how the FDA has found out that this drug here has caused all these things, and then we're going to, all these lawsuits are happening. It's like, wait a minute, the FDA was the one that approved it in the first place, so shouldn't the FDA be accountable for approving this drug in the first place? You see,
sure.
We've got these things happening all over this country where the FDA is supposed to prevent the stuff. Well, they're not being held accountable for the side effects of the drugs that they're just passing nilly-willy. And another thing about checking on trying to get license taken away from a doctor, what the FDA is doing, they're trying to put doctors out of business that have cures for cancer and cures for very good diseases that need to be cured, because that's how corrupt our government system is, that's how corrupt our FDA system is, and the medical profession is that if there was a doctor, I know there's doctors out there that had cures for cancer, what does the FDA do? They go right after them to take their license away.
Well, let's comment on some of that. About there have been drugs, of course, that have been approved, and in fact, you've had the birth control lawsuit. I mean, that was approved by the FDA, was that not?
It was, and so was Vioxx, and so was Pradaxin,
yeah,
so was Fen-Phen, and I mean,
yeah, Fen-Phen. I was going to say that.
Greg has hit the nail on the head with the FDA. There's no question that first of all, you can't sue the FDA for not properly doing their job in terms of evaluating a drug prior to marketing. They're a governmental entity. There is no permission to sue the FDA on that, so they are immune from suit when it comes to that. A lot of people, unfortunately, believe that the FDA is a bunch of people with white coats on and beakers pouring stuff, and that is not who these people are. These people are doctors and scientists, but what they do is they review materials of clinical testing data to make a determination of whether or not a drug passes a certain threshold to where it should be marketed. And their evaluation of that drug, can change from time to time, and they have to rely principally on what the manufacturer supplies to them. And so if the manufacturer lies to the FDA, and that does happen, sure, unfortunately, Nick, then the FDA will go ahead and rubber stamp this drug for approval, and then the side effects that were known during clinical testing are spread out to tens of and hundreds and thousands of people, and then the FDA has what's called a signal, and they then learn from that point, hey, we need to beef up a warning. this is happening with regard to all kinds of drugs. And there's a new drug now that's been approved. It's I don't remember the name of it. It's the female Viagra. Have you heard about that?
Yes, right. That's interesting to me. Like with men, Viagra, it affects blood flow to the groin region. This
works
affects
on the brain, the female brain, and it is going to be.
It's controversial, but it's approved.
It is approved, and I think you're going to see in the years to come that this might have been a huge mistake.
And when you say that, I mean, what are we hearing about? We don't know right now, but I mean, we think it can do some damage. I mean, we haven't seen any of that. There had to be
my
testing.
understanding at this point, it works primarily on younger women, which makes you wonder because I would think that the older women would be the ones that would need this more. But again, it works on the brain, and anytime you have something working on the brain that can affect someone's libido or affect someone's sleep habits, or for those that may be mentally unbalanced, who knows what can happen. It's just I just put a check mark next to that drug because I think in the years to come may have some problems.
And so then, of course, folks like yourself and others can get involved in class action lawsuits, not suing the FDA, as Greg suggested, but perhaps going after the manufacturers, especially if you can prove that they kind of knew some of this stuff and just. And that goes to also, do you believe, and I think, politics and economics have a lot of pressures on FDA approval as well. You hear that FDA, it can take forever for a new drug to get approved, and then all of a sudden, magically, some other drug just that fast. And you're wondering, what senator made a phone call on this one?
Well, it goes back to Greg's point about the fact that there may be doctors who have cures for cancer who the FDA either wants, I don't know if they take their license away, but they're not going to approve the process. But a company that has a lot of political clout, economic clout, gets their drug through fairly quickly. And so I think there's merit to what you're saying, that if you're Pfizer and you've got a drug and you obviously make a lot of political contributions, you're going to have much more power than an individual who may have a cure, maybe even tried to patent a cure, but the company hadn't picked up on it, and the FDA doesn't feel compelled to get it approved.
Interesting part about that, and the drugs and the suits on that. Again, the phone number 737-7587. If you want to jump in, we can take your calls, questions for Clint. Is there a case to be made that hospitals, as you've said before, they're sick places? Of course there are sick people here, but I'm hearing, and I've got more friends who have recently had either acquaintances or themselves treatments in hospitals, and they came out sicker than afterward with something else, with some of these infections they get. I'm actually afraid, if there's a time I need to go in for surgery, wondering about going into a hospital. Of course, you have to have it done. Let's say they lop out my appendix. But then I'm wondering what else. I mean, how bad is it getting in hospitals in your mind? And are there cases to be had if you go in for an appendix and then all of a sudden you get this horrible infection because there's MRSA or whatever floating around? Can that be a case?
Well, let's get back to the original question. Should you be afraid? Yes, you should. Okay? The infection rate in hospitals has gone up substantially.
Why?
Well, first of all, antibiotics have lost some of their power because they've been overprescribed. So we have superbugs like MRSA. Secondly, we have greater populations coming into hospitals, and so there's more sick people coming in, which means there's more bugs in the hospitals to be transmitted. There have been some criticism over the way that hospitals are disinfecting their instruments, or whether or not the instruments that they get or supplies they use are properly cleansed. But it's a simple matter of statistics. Now, I don't know the exact statistic. I'm sure it's very, very small, but it's never small when it's you.
Right.
And so what I tell people is, if you can avoid going to the hospital, by all means avoid it. It's just it's full of bugs, and it's hard to hold a hospital responsible if you catch a bug. Now, where you can hold them responsible is if they fail to diagnose an infection and it gets way out of hand, and then it causes a severe injury or death. Now, that's a different matter entirely. And I had a case in Jackson one time where there was, in fact, a positive blood culture, that an infection was detected, and the nurse who found the infection failed to notify the treating doctor of it before the patient was discharged, and she died 3 days later from MRSA. Now, that was a case.
Okay, and they knew about it, and so they just a communication gap there.
Yes.
Failure to communicate before, and that was able. I really started thinking about it more when we talked with you on previous shows, and I didn't realize it. And since then, I paid attention. And you go to hospitals, any hospital. Some are better than others, maybe, as you said, in the cleanliness. I don't know. I just have this image in my mind of an OR being a pristine place, clean in emergency rooms, or not emergency, rather operating rooms. Just pristine, and that, kind of like antiseptic. And It's not. It's like I'd rather have them perform the surgery in my living room. Well, no, I'm not seriously.
I'm not going to comment on
saying,
that, Nick, but your point's well taken about the fact that you think that a hospital is completely antiseptic. That's not true.
Yeah, okay, fair enough. Now, let's go to Sarah. Sarah, good morning. Hi, Sarah.
Hi.
Hey, how can we help you?
I have a friend who had a stroke about a year ago, and she fell, knocked teeth out in the front when she fell, and since then she's in there for rehab, and she told me that some of the teeth, she needs them fixed, and some of the teeth in the back are giving her trouble. She has cavities, so they have a dentist who comes by about every 3 months. I called their office, and the lady said, well, all we do is clean or pull. And so I called her primary doctor and asked, is there a way she can go to another dentist? They had put her on Medicaid after she'd been there 3 months, and I was told that the doctor said that's all they need in a nursing home is to be cleaned or pulled. So I was just devastated, and she is too.
Cleaned or pulled as opposed to maybe getting a filling or something like that?
Yes, just a filling to preserve her teeth. She's not all that old, and even if she were, old people deserve good treatment.
Well, amen to that.
Yeah, any thoughts? Yeah.
It's hard for me to know what Medicare covers and what they don't. Okay, I mean, that's the truth be told. I don't know how to answer a question any better than that, but what I do believe is what she said, and wholeheartedly. Our elderly deserve to have the best care, certainly as good a care as young people have. And you talk about lack of resources, you can talk about the system being overburdened. I don't care. These people paid into our system, these people contributed to our country, and these people deserve to have the best care that they can get. And I can tell you from personal experience, they don't always get that. And it's just flat out not right. And the only thing that makes me madder than that is what happened to the veterans.
Yeah, I was going to say that too. Right.
So, I wish she could get crowns. I wish she could get some restorative treatment. I don't know if there's a private plan that supports Medicare, but I don't think we're doing right by the elderly.
Yeah, sometimes there are supplement plans, and I don't know exactly, but if that's all they covered, I'm with you on that. And again, what happens in nursing homes or at VAs, especially with the elderly, if there's not people like Sarah to be there to look out for this and make a stink, family members just being there, going and visiting, can make sure at least everyone says, oh, well, he has visitors, we better make sure we take care of him.
That is a great point,
It's a shame
Nick.
it comes to that, but the poor people that are there that don't have anyone, I worry about them especially.
Point. And it's not just them, Nick. Anybody that goes to the hospital needs a patient advocate.
Yeah.
If you go and you're going to stay for any period of time, you have your wife or your significant other, friend, someone be an advocate and have that person ask questions and never be afraid to ask questions, because you might keep somebody from getting injured or killed.
You aren't kidding. Blind faith or trust in a doctor. Respect, yes. Blind faith and trust is foolish. And I tell you, my wife and I talk about this all the time. When I'm there one of these days and I'm going under heart surgery, I just want you asking a ton of questions. And she knows going in that I will too.
Yeah.
So that's what I do for her. Listen, we'll take a break on that note. If you're on hold, stay there. We'll get to more of your phone calls, more with our guest, Malpractice attorney Clint Kelly, right after this.